from share my screen, you can go to the view broadcast.
Hi, welcome to our Rapid Rehousing webinar series. This is Jen Saunders, a Senior Program Officer with the National Alliance to End Homelessness. We are so delighted today to have our two speakers who are going to be talking about transforming the homeless system in Pierce County, Washington. Just to sort of kick us off, I'm going to do a quick slide to talk about Rapid Rehousing, which I know most of you are familiar with. Then we will have Tess Colby, who's Housing and Community Development Manager with Pierce County, Washington, who's going to be talking about how the county has transformed its homeless service systems by reallocating a significant amount of transitional housing to rapid rehousing. We will then have Joe O'Neill, who's Executive Director with the Exodus Housing Program. He'll discuss his work as a rapid rehousing provider for victims of domestic violence. With that, I will give a very brief overview of the core components of rapid rehousing, which most of you, or pretty much everyone on the line, I'm assuming, is familiar with. It consists of these three components, which are housing identification, which is primarily assisting households to find and secure appropriate rental housing. Rent-in and move-in assistance, which is financial assistance to help individuals pay for rent and assistance to cover move-in costs. And then rapid rehousing case management and services. One thing too that's really important to note is that all three of these services really need to be offered in a rapid rehousing program. While it's not required that one program provide them all, or that the person actually use any or all of the services, but it's important that all three be provided. One thing I should mention that it's also important to take a broader view and look at how rapid rehousing can transform a homeless system. For example, by reducing wait lists for shelter and capacity demand. The role of transitional housing in a homeless system is also shifting, and we'll hear more about that today from our presenters. I do want to mention that this is a webinar series. We've had several webinars in the past. These are listed on the slide, and also you can find them on our website. We have several that have covered the core components of rapid rehousing, ramping up rapid rehousing in several communities, the targeted populations such as single adults and serving youth and young adults, and transforming homeless systems using rapid rehousing, which is the subject of our webinar today. And we will also have another webinar on March 8th that I will mention at the end of our webinar series. So with that, I also wanted to mention that we'll be posting these slides and the audio on our website tomorrow. And that if you have questions, please post them and send them to us. We'll be doing the Q&A at the end of the presentation. So with that, I will turn it over to Tess.
Thanks a lot, Jen, for the opportunity to participate on today's webinar. So you can go to the next slide. So Pierce County, just quickly for some context, Pierce County is the second largest county in Washington, and we're located south of Seattle with a total of about 800,000 people, total population. About a quarter of our population lives in our largest city, Tacoma, but the remainder are all in small cities under 60,000 or rural unincorporated areas. So we've got a lot of land, and much of it is sort of sparsely populated. Our median income is around $71,000 for a family of four, and our market rents for a two-bedroom unit is $1,100, which is affordable to a family earning about 60% of the area median income. So with about 12% of our population below the poverty line, we estimate that Pierce County needs an additional 50,000 units of affordable housing to meet the needs of low and extremely low income families. So like many communities, we have a very large affordability gap in Pierce County. Also, like other communities, as we're pulling out of the recession, our vacancy rates are declining. Vacancy stands right now in Pierce County at 3.5%, which is down from 5% just a year ago. And because we've got Seattle to the north of us that is an extremely high-cost market, our market gets squeezed every time the rents in Seattle go up, which is most definitely happening now. If you're hearing anything about Seattle in the news, probably a lot of it has to do with how expensive it is to live there. The market rent for a 2-bedroom up in King County, where Seattle's located, is $1,400, almost $1,500, and so you can imagine that pushes a whole lot of families south and north. Our continuum of care operates about 2,300 permanent and temporary beds. Oh, sorry, go back. Temporary beds, almost half of which are targeted to families with children. In 2015, we counted almost 1,300 people experiencing homelessness. Last year, we saw an increase in our unsheltered count of about 340, and this year we're expecting that unsheltered count to go up again. The PIT is a great resource for tracking trends, but it's not always the most accurate count of who is actually experiencing homelessness throughout the year. So we also use our coordinated entry data to help us understand who's becoming homeless. Last year, through coordinated entry, almost 4,000 households called who were experiencing literal homelessness, and about 1,300 of those were children, were families with children. Okay, so this slide shows the trajectory of our homeless system over the last 15 years, which really had been predominantly focused on building up transitional housing for families. We had a big influx of capital funds between 2001 and 2010 from a program called Sound Families, which was funded mainly by the Gates Foundation, and it resulted in the creation of over 200 new owned transitional housing units for families. And by owned, what I mean is that the providers actually built and owned and operated those units, and a whole lot more units that were leased but that had project-based Section 8 vouchers. So after years of relying on this temporary housing model, in 2009 we set our sights on developing more permanent housing solutions, starting with HPRP. We've been pretty much in continuous system improvement mode ever since. We implemented our coordinated entry in 2011. We started conversion of transitional housing in 2012, and began implementing our own rapid rehousing program in 2013. So this year we're focused on refining our coordinated entry and moving to prioritizing referrals based on vulnerability and housing barriers. Between 2011 and 2016, we reduced our transitional housing units by 83%, from 650 units at the peak to 110 units, which is what we've got left. So all the remaining transitional housing in our COC serves families, and most of it is owned by the service providers. Next slide. Much of the, can we move to the next slide?
Yeah, sorry, we're just having a little issue with that.
No worries. Okay. All right. So much of the work since 2009 has been focused on transforming our response to homelessness from what was a random group of programs reliant mainly on temporary housing along homelessness to a crisis response system that's focused on quickly helping people move back into permanent housing. So our crisis response system will aims to be appropriate for the household's needs. Coordinated entry has helped us truly appreciate the resilience of families and individuals. We've learned that people who are waiting for a referral to housing resolve their crisis and regain housing without our assistance. In fact, yeah. So we're embracing the use of prioritization tools to help us identify the strengths and resources each household has, as well as their barriers and challenges, so that we can refer households to the appropriate housing intervention. In this way, we reserve the highest cost resources, like permanent supportive housing, for families and individuals with the highest barriers and vulnerabilities. Because we know that homelessness for many people is a one-time experience, we don't want to deliberately extend the homeless crisis unnecessarily. So we are working to divert as many people as possible from entering our system. so that long stays in shelter and transitional housing don't unnecessarily prolong homelessness. We piloted a diversion program beginning at the end of 2014 that works with families from no more than 30 days to help them come up with a plan to regain housing. And we're finding that many families can be diverted with a very light assistance. In that same vein, we also know that everyone is in fact housing ready, so all of our investments in the system will be in low or no barrier programs that embrace a housing first model. The system will reflect that the universal solution to homelessness starts with housing. Wait lists have been a fact of our system since the first housing program was funded more than 20 years ago. Coordinated entry, we found, didn't invent the wait list, but it certainly did consolidate it into one place. So our crisis response system needs to be more transparent about how long the wait might be and what kind of assistance may or may not be available, especially as we're reserving resources for the most vulnerable clients. We know that the homeless system alone hasn't been successful at ending poverty. We also know that the homeless system can't end homelessness without collaborating with other mainstream services, such as our colleagues in education, employment, and healthcare. So changes to the system also need to increase collaboration across systems and must include assistance to clients to navigate those parallel systems. Finally, our system needs to be accountable to our funders, to our providers, and most importantly to the people that we serve. So we're getting better and better about using data to help us understand system-wide and program-level performance. We also are getting better at disaggregating that data to understand outcomes through an equity lens. And then we need to use that data really to consistently improve how we're assisting people in resolving their crisis of homelessness. Next slide. So in 2013 and 14, the Corporation for Supportive Housing assisted us in assessing on a project level and a system level how well our system was meeting the goal of making homelessness rare, brief, and non-recurring in Pierce County. We started with a project-level analysis of transitional housing programs to better understand the mission of the agency and the perspective of their board with respect to the programs that they were providing, how the physical layout of the program could impact conversion. So, for example, congregate living isn't conducive to conversion to permanent housing. Who the program is serving, are they serving literally homeless families or families that are at risk, households with disabilities, chronically homeless families, or first-time homeless, and what the program outcomes are for their participants. And we looked at program operating resources and capital investments to determine what impact conversion would have on capital covenants. We met individually with each transitional housing agency, which was a really critical piece of our process. It allowed us to reiterate the COC's commitment to shifting our investment to permanent housing, and it let us hear the stories of agencies that were both ready to convert and those who weren't. It created space for some agencies to take the initiative to move forward with conversion and gave those uncomfortable with the shift plenty of time to plan. Our next step was to do a system-level analysis to assess whether our current system of housing programs was meeting the needs of the families and individuals seeking our assistance. As part of the systems analysis, we looked at system-wide outcomes to determine how best to align our investment to meet the needs. And all of this analysis was really with the goal of becoming a strategic system that effectively and efficiently responds to homelessness. So next slide. So I'm going to linger a little bit on the systems analysis. This slide shows the basic questions we wanted to answer to get a broad picture of who we're serving and how well we're providing those services. And because the vast majority of our transitional housing serves families, our system analysis focused on the network of programs that serve families with children. So we asked how many families become homeless each year, and the data that we looked at was the point-in-time count and the number of families that come through coordinated entry. We did this again because, again, the PIT does a really fine job of telling us who's sheltered, but it doesn't really tell us much about unsheltered families in particular. Coordinated entry tells us who's literally homeless, and who's seeking services, most of whom are not in our shelter. So I said earlier in the webinar that about 1,300 families a year go through a call or get in touch with our coordinated entry, go through coordinated entry. But what we found out by looking at the actual referral information and digging deeper into our coordinated entry was that about 500 families actually get served in our system every year, get a referral to housing and or get some other kind of diversionary services. That number, it turns out, was consistent with the annualized PIT number that we had. So we felt pretty comfortable about that 500 being a target, at least for families. We used HMIS data to answer the question about where families come from, where they, whether they were literally homeless, they were coming from shelter, unsheltered, or places not meant for human habitation, or were they housed but at risk. We used the length of stay in shelter and transitional housing to help us understand how long families remain homeless after entering our system. We also used data from our coordinated entry wait list to better understand how long families wait to even get access to shelter or a housing program. That data also taught us a lot about how many families self-solve their homeless crisis while waiting for a referral to housing. We found that about 30% of families identify housing options on their own within 30 to 90 days of becoming homeless, and another 25% or so lose contact, coordinated entry, and don't come back. So again, this was really helpful in affirming our belief that investing in programs will help resolve homelessness for a significant portion of our clients. We wanted to know how successful our programs are at ending homelessness. So we asked whether families were leaving transitional housing and shelter for permanent housing or returning to homelessness. And we wanted to know how efficient our system is. So we looked not just at the cost of operating a program, but at the cost per permanent exit, which we found to be quite a bit higher than the average cost per family enrolled. Next slide. So we took that system level information and drilled down to a comparison between transitional housing and rapid rehousing. On the question of where families came from, we found that shelters in transitional housing served more at-risk families than rapid rehousing. We think that's partly because our shelters and transitional housing programs were more likely to be bypassing our coordinated entry than our rapid rehousing providers were. So there were these side doors that the transitional housing programs were using where they were taking referrals directly from shelter into transitional housing. So one of the, that helped us to understand a little bit more about how we need to refine our coordinated entry to eliminate those side doors. We also found that transitional housing programs were largely serving families with low barriers. Few of the families in transitional housing had multiple episodes or lengthy periods of homelessness before entering the program. Very few had family members with a disability or extensive criminal backgrounds or evictions. Indeed, what we concluded was that a lot of the families in transitional housing probably could have easily been diverted. So on length of stay, it's kind of no surprise that the lengths of stay in transitional housing are 3 times as long as rapid rehousing. That means that shifting to a crisis response system that's focused on permanent housing will actually allow us to serve 2 to 3 times more families with rapid rehousing and diversion than we would have if we'd stayed with a temporary housing system. So the exits to permanent housing, while lower for transitional housing in absolute numbers, were comparable as a % of total exits between transitional housing and rapid rehousing. And of course, the cost per permanent exit from transitional housing was significantly more expensive than the cost for rapid rehousing. So our conclusion was that as it had evolved, our reliance on transitional housing meant that we were investing 3 times as much in an intervention, transitional housing, that served only about 1/3 of the families needing assistance, and that those in transitional housing were the least likely to actually need a prolonged stay in a housing program. So we committed to converting the vast majority of our transitional housing to permanent housing and retaining only transitional housing programs that serve a specific population who needs a temporary, who needs the temporary combination of housing accompanied by intensive services. So such as youth exiting the foster care system and parents in recovery that are working to regain custody of their children. So those are examples of specific populations where we're considering transitional housing as an appropriate intervention. Next slide, please. So between 2012 and 2016, we reduced the number of transitional housing units in the COC by 83%, mainly by reclassifying units with some actual reallocation funding. So as I mentioned earlier, a huge percentage of our transitional housing was accompanied by project-based Section 8 vouchers, which made the reclassification process pretty easy through the housing inventory chart. We did that, of course, with the consent of the provider agencies who understood that the reclassification would impact their program model. In that instance, most providers were already treating their transitional housing units like permanent housing, so the conversion was universally very well received. Similarly, in 2012, we converted units that had received funding through a state-funded program for the operation of transitional housing. When the state expanded that program to support an integrated system of housing assistance, the units were converted to rapid rehousing and were awarded funding through that expanded program, that expanded state program, but also through our local county funds. In 2013 and 14, we amended COC contracts for projects that had, during the contract period, shifted their program models from transitional housing to either permanent supportive housing or rapid rehousing. And we worked with our local HUD field office to amend those contracts. And then in 2014, we reallocated transitional housing projects to permanent supportive housing and rapid rehousing through the COC funding round. And we've got other transitional housing project units in the current funding round that we're also proposing to reallocate. Next. So what remains then are about 110 units of transitional housing, most of which are owned and operated by the provider agency, and most of which are not serving a targeted subpopulation. So we're currently in the process of providing technical assistance to these providers to assess what impact conversion will have to their agency mission, to the program design, to the clients that they serve, and to their project finance. But in the end, we expect about 20 of the remaining units to continue to operate as temporary housing, serving women in recovery and who are also trying to reunify with their children, and young women who are pregnant and homeless. We expect the remaining projects will either convert or they may opt out of receiving COC and county funds. Our goal is, starting in 2017, to reduce all funding to transitional housing to only projects serving a targeted population. Next. So conversion of transitional housing has helped us to move to a system focused on providing permanent housing. In 2012, over a quarter of our investments were in temporary housing, with a like amount in rapid rehousing. In 2016, 92% of our housing investments were in permanent housing, evenly divided between rapid rehousing and permanent supportive housing. And then the next slide shows really the impact on the numbers of households that we've been able to serve. So the shift in investments has dramatically increased our ability to resolve the crisis of homelessness in Pierce County. The number of households we can serve in permanent housing has increased by 42% since 2012. You see on the chart a decline in 2016, and that's really the result of a reduction in funds available locally and from the state. But we expect that that reduction will reverse itself in 2017, and we'll go back to an upward trend in the number of households we can serve. So next slide. So our ongoing system changes include continuing to refine our coordinated entry system to include an assessment that prioritizes referrals to housing based on housing barriers and vulnerability. We will be matching the housing intervention to household barriers and vulnerability. So we expect that low barrier households, for example, will likely be diverted from entering the system. Higher barrier households will likely get a referral to a rapid rehousing program, and chronically homeless households who are typically the highest barrier households and the most vulnerable will be referred to permanent supportive housing, or where that's not available, rapid rehousing. So our focus will continue to be on increasing our investments in permanent housing with the goal of having enough permanent supportive housing to serve our chronic population and other extremely high barrier and or vulnerable households. The success of all of this systems change work really relies on our provider agencies. So interwoven throughout the work we've done to date and the changes yet to come is our commitment to bringing trainings and technical assistance to the providers to increase their capacity to serve. And on that note, I'm happy to turn this over now to Joe O'Neill, who is going to talk to you about how his agency shifted from transitional housing to rapid rehousing.
Okay, so again, my name's Joe O'Neill. I've been the Executive Director of Exodus Housing for the past 7 years. And what we're going to cover today is just a brief history of our agency. We're going to review some of the key differences between transitional housing and rapid rehousing. Then I want to spend a couple of minutes discussing the unique barriers DV families face and how our paradigm shift and strategies are used to successfully serve this population. Next slide. So a brief history. So we've been around for 22 years providing housing support for homeless families. And in 2009, we converted to 100% DV families. We always started back in the beginning serving DV, but in 2009 we realized that we had plenty of clients, unfortunately, so we made that conversion. And that's also when we started our rapid rehousing with our first DV family. We had a small staff, 7 full-time staff members. 3 of those are case managers, and 1 is a case management assistant that helps with all the in-office process for working with the families. So we had a small budget, really, $920,000 for 2016, and about roughly 74% of that funding is government funding, mostly in cost reimbursement contracts, and the remaining 26% comes from fundraising. So we write a lot of grants. We get funding from United Way, a lot of churches, Rotary clubs, service agencies is where the rest of that funding comes. Next slide. Okay, so in 2015, we housed 114 low-income single-parent families with minor children who are fleeing domestic violence. So that's basically HUD Category 4. 119 of those families were in rapid rehousing. Their average stay was 8 months. And we had 21 families that were in transitional housing. Their stay was 20-plus months, and in July, we terminated that contract to focus 100% of our time and effort to rapid rehousing for DV families. Next slide. So some of our outcomes in rapid rehousing. Last year we had 48 families that exited. 83% of those families were able to transition. 76% were employed. With 73%, they maintained or increased their income. So you understand what that is. Our average entry income was $8,800, and the average exit income was $16,700. So their income almost doubled over that 8-month period, and a lot of that is because many of them didn't have jobs to start with. So just in getting a job, even if it was a minimum wage job, they started increasing their income, which is one of the key components in being able to maintain permanent housing. You have to have some level of earned income. Next slide. So just a brief review again of transitional housing. The housing is in fixed locations in our case. It was always in fixed locations. We held the lease, the agency held the lease. The client's name was never on the lease. The clients paid their portion of the rent directly to us, so we were in essence the landlord, and we weren't very good landlords as far as, somebody was late with a payment, we would just eat it usually and just keep the family in the program. and that wasn't always the best thing for the family to realize that they didn't have to pay their rent on time. In essence, the clients gained no rental history. They had little, if any, engagement with the landlord or the property owner. Then with most of our clients, after 12 to 24 months, they had to move out of the program. And you can just imagine, first of all, they had to find a new place to live. They had no rental history, and they had to pay for the move-in costs. So, all the application fees, deposits, all of that kind of stuff that had already been paid for by the agency is now something they're responsible for trying to come up with as they transitioned. Next slide. So now we're looking at rapid rehousing. So this is where the big key is, especially for DV families. The clients decide where they want to live, in our case in Pierce County. The lease is in their name, and they pay 30% of their income directly to the landlord, which is a big key. They have to have that relationship with the landlord and follow the landlord rules. So they gain that rental history, and for the most part, the clients can normally stay at the end of the program. Again, it was about 8 months. So what does, the client remains in stable housing. They have no additional out-of-pocket fees or costs. Another significant point is they don't have to change their schedule or lifestyle. So for the past 8 months, they've been maybe working, going to school, they got friends and neighbors. They're starting to establish a relationship with that location, which is a huge part of stability. And that's why one of the reasons we like rapid housing so much. Next slide. For this presentation, I'm not going to go into a big discussion about different aspects of serving DV families. I put the power and control wheel for domestic violence there, just as a point of emphasis that everybody that is in a domestic violence situation isn't necessarily impacted by every component of the power and control wheel, but in knowing what areas they may be impacted by can help the case managers in the process of helping the family get the help they may need. And not necessarily that our agency can provide that help, but knowing what support they need and being able to get that help to the family through referrals and those kind of things. So an example would be, so you have an abuser that used economic abuse. So they prevented the mom from getting a job. So if the case manager, in knowing this, that she was prevented from ever working, she may not know how to go out and find a job. So the case manager is in a position then that they can help them with the resume application, interviews, proper dress and appearance, those kind of things that'll help the family to get to the point where they do have employment. Let's see. So the big part of this is with supporting domestic violence families, education and training is really the key. The more you learn and know, the better prepared you'll be to tailor your services, your case management, based on what the family specifically needs. Next slide. So some of the unique barriers that DV families experience, first of all, it's always a single parent household, so there's one potential breadwinner. So some of those common barriers, higher rate of depression and mental health barriers. They got lack of work history often, lack of a support system. They've been isolated, so they don't have, isolated from family and friends. This is often a situation, so they don't have any outlets. So after they flee from the abuser, then they have no support system. So helping them establish a new support system is key. Often they'll have criminal charges. We've had plenty of cases where the abuser made our client go into a store and steal something. They get caught. They're the ones that end up having the felonies and the charges against them versus the abuser. They often have a lack of documentation and essential things that they may need. So having a driver's license, a vehicle is a big one. Simple things like a bank account or having their birth certificates and social security cards. They don't have those often because when they fled from the abuser, it wasn't the kind of things they were thinking they needed to take. So now they're away from the abuser and they don't have those documents and things like that they need. Plus they've left all their household goods and furnishings. So when they do move into an apartment, it's essentially empty when they first move in because they don't have a moving truck coming to drop off a bunch of household goods. So that's a big a common barrier to gaining that self-sufficiency. Then there's also the rental barriers, as we talked about before, with no rental history. They may have broken leases and evictions. They may owe money for damaged property, past due rents, utility bills. And what we find here is often the client will flee from the abuser and not realizing that their name is also on the lease, and the abuser either wrecks the apartment, moves out, doesn't pay their utility bills, and then later on when we're working with a family, we find out, oh, you owe all this money, so you can't get into a place because you haven't paid your utility bills. It's the same utility company. They won't turn on your utilities until the past due stuff is paid for. Next slide. So here it comes with the paradigm shift in service delivery. For 15 or plus years, we were doing transitional housing. So in essence, the lease is in the agency's name. The programs were agency focused, in my view, and we used a lot of power and control techniques ourselves by requiring the case managers to go to the family's house and do an inspection on the house, make sure everything is working and clean and things like that, because we had a vested interest in protecting that property, almost more so than the family, because eventually that family would move out. We need to bring a new family into that unit. So for the past 6 years in using the rapid rehousing model, it is the lease is in the client's name, and it's very client focused in the types of services we provide. So instead of the types of power and control we're using in transitional housing, we're looking at our case managers are supporting and encouraging the families in a different way than we had done with transitional housing. So learning is a big key. Learning how to use motivational interviewing, trauma-informed care, progressive engagement, tailored services. These are all different types of knowledge-based activities that as the case managers attend these different types of training, it puts them in a better place to be able to support the families. And it's really, really important to understand that every family is unique. So every family has a different type of service plan. And if you ever get to the point where you think you know what the family needs or what the family wants, then you're basically putting yourself in a position of power and control over the family. Never assume or presume that you know what they need or what they want. It's always up to them to help explain what they need, where the case managers have to actively listen and work toward helping the family grow and develop and to be able to have their own voice, which often they don't necessarily have when they first come into the program because they've been controlled by their abuser. We want to reverse that course, so the training is really important there. Language, we eliminated all controlling language and practices, and if you go through all your paperwork and you'll often find words that are words of power and control over the family, and you just want to look at that and review it. We're constantly reviewing our stuff to make sure that it's family focused versus agency focused. We reduced our application from 8 pages down to 3. We made it available online, and we discontinued multiple interviews for one opening. So in the past, we'd interview 2 or 3 families for one opening, so there was always 1 or 2 families that had their hopes up only to be squashed because we weren't going to serve them. And we also found that conducting long interviews had really no bearing on how well a family would actually do within the program. So in discontinuing that, now we conduct a phone interview. So basically we call the family, we do the screening by asking them questions to ensure that what the application we have is still accurate. We explain how the rapid housing program works, and if the family feels it's a good fit, then we accept them into the program. And then if possible, we never want the families to have to jump through any hoops. So my case managers will go to where the families are to do all the intake paperwork and case management and support, instead of trying to get the family to somehow prove that they really want to be in the program by coming out to our agency, which is about 1.5 miles from the closest public transportation. So again, everything we do is focused on what's better for the family, not what's better for the agency. Okay, next slide. So again, I can't overemphasize this. The family is absolutely in control of their future. The lease is in their name, so they have to follow the landlord rules now, which in the past, transitional housing, they could follow the agency policies and procedures and rules, and we weren't very good landlords. So now, if they get a 10-day pay or vacate from the landlord, now that's reality. Now they're living in like everybody else in the apartment complex. By following those rules, they become a good renter because they understand what those rules are instead of just using the agency as their landlord. So the other key point is we don't know what they consider to be sufficiency and success. Let them tell you where they want to get to versus you telling them where you think they need to be. Customizing case management communication, we found is one of the things that really sets us apart by utilizing technology. All of my case managers have iPhones and iPads, and they use this, they can do their case management using text messages, phone calls, FaceTime, all of that technology, because you don't necessarily have to provide case management face-to-face because of the time restraints. The family has lots of different things going on. Sometimes the case management, they might just have a couple of questions that easily can be answered utilizing technology versus trying to always set up a face-to-face meeting. Another key that we started doing about 6-8 months ago was I require all of my case managers to take the family, if the family wants to, out for coffee or lunch at the beginning of the program entry. And we found this is one of the quickest ways to build up trust and respect and help the family realize that we're really there to help them and help listen to them and help them on their path to what they view as being self-sufficient. Next slide. So another component was focusing on what our agency is good at. And the things that we're not very good at, we developed partnerships to serve the families. An example is we used to have a staff person that did education and employment. That's what their job was, to help families decide what kind of education program they needed, helping them get into a job, seeking a job. Then we realized that we have lots of great nonprofits and government agencies that's what they do. They're really, really good at it. Example would be Goodwill. It's one of the greatest job training agencies, I believe, in our country. Certainly out here we got a great Goodwill. So instead of trying to duplicate what they're doing, we let that position go and develop a relationship with Goodwill. So that's where we send families, as an example. One of the places we send families so they can do job assessments, figure out what they need to do to become employed or education, those kind of things, and enabled us to continue to focus on providing what we are good at, which is case management for families that are fleeing from DV. Another piece is 70% of the families that come to us have absolutely nothing. So when they move into the apartment, it's empty. I mean, they basically need everything from a shower curtain to towels and cleaning supplies to the beds they sleep on, pots and pans, you name it, they need all of that. And I don't believe we have found that there is really no movement forward for a family without having a house that is furnished. So what we do is we write for a lot of grants, a lot of small grants actually, and they're fairly easy to submit, usually not really lengthy. They don't usually have a lot of a lot of reporting requirements that take up a lot of staff time. So those grants, we write those grants specifically to help the families. We tell the foundations and trusts that whatever money they're going to give us, we're going to use specifically for what the family tells us they need. So one of the biggest, as I said, household goods and furnishings. Without that, don't expect any movement. Minor car repairs, bus passes, gas cards, work clothing, even clothing for the kids. You got a teenager that fled with mom. She has no clothes, and she's 16. Let me tell you, she's not. I got a daughter that age. She is not going to go to school if she can't look right. So maybe one of the most important things we can do is help the mom, give her some gift cards to take the girl her daughter to get clothing so she goes to school, because we think about it as a whole family. So once the daughter starts going to school, now the mom can focus on moving forward herself. She can't do that if she's focusing her time on her daughter that's not going to school. But we pay for traffic tickets if that'll help. It'll help get a family a license. We pay for past evictions, utility deposits, arrears. We pay for legal services, particularly around child custody and divorces. Again, the abusers often have the money and the resources. The victims don't. So that's where we come in and spend a lot of time and energy helping the families. Again, what are their specific needs? What are they telling us? And that's what we're going to try to help them resolve. Sometimes it's a matter of referrals to specific agencies. Sometimes it's providing some specific financial assistance to rectify a certain situation that's preventing them from moving forward. So those are the type of things that we do that maybe are different than we did in the past, and we find that these are the kind of things that help propel the family into a successful track toward achieving that their version of success, of their version of having that ability to retain that permanent housing without Exodus Housing or any other agency coming in and trying to provide that support. So then lastly, I'm moving through these slides really quickly because I want to make sure we have time for questions. The next slide is when you're working with DV families, it's very, very stressful. So self-care is a must. In my agency, I ensure that everybody has a self-care plan. I talk about it all the time. I ask them what they're doing to relax at night, what kind of activities are they involved in, and so we constantly having those conversations. I do that because I want to make sure that they're thinking about self-care all the time. So things like taking vacations, they staying home when you're sick. Your job is not that important that you have to come in when you're sick and try to do things. When you try, other staff may get sick, and so it's really a matter of taking care of yourself. I don't want them to take any work home, so I have them turn their cell phones off at night. We debrief stressful situations at work. I don't want them going home and having that burden on them that can affect their families. So it's a matter of having that healthy amount of professional detachment. You can't have so much invested in a family that if they fail in any way, that you feel you're responsible for that. So having that healthy sense of that professional detachment, knowing that, as I tell them, can you look in the mirror and tell yourself that you did everything you could do to help that family? And if that's the case, then you just got to accept the fact that maybe they didn't want to make the progress and they were unsuccessful. Now you need to move on and be able to provide the next family you're working with the type of support they need. Again, empathy versus sympathy, a way to think about how you're providing your support. And lastly, seeking that professional help anytime you need it, realizing that we can provide referrals to support our staff as well as we can the families we serve. And then there's no reason to do anything if you're not having fun and laughing a lot, especially when you're in a stressful type of work like supporting DV families. So I say that over and over, are we having fun? Are we laughing? We do a lot of team building kind of activities to help get those conversations going that can help relieve stress on the families, particularly when they've had a rough time with a family or that isn't making any progress. They're beating their head against the wall trying to help the family make progress. If they don't want to make progress, it's not the case manager's fault. And they have to be able to unwind, and at the end of the day, do they have a smile on their face and are they happy when they go home? Because if they're not, the next day they're not going to be as successful in helping a family if they start getting too wrapped up in the problems. Next slide. So essentially, there's no use whatsoever trying to help people who do not want to help themselves. You can't push anyone up a ladder unless he is willing to climb himself. So that's an example. We make sure that we're thinking, okay, we don't want to be working harder than the family. We're providing the family with all kinds of options and resources. And then the family has to choose what is it that they want to take advantage of and what is it that they need, what are they telling us, and we try to find ways to provide that support. So in essence, that is our program. There's a lot more to it, but this is just a quick rundown of some of the things that, the way that we transition and the way we think from when we were providing transitional housing to what we're doing now with the rapid rehousing. And I'll just say we transitioned, when we dropped the transitional housing program, everybody in the house and our staff became much happier because we weren't having the type of success with transitional housing as we currently do with rapid rehousing. And that's another piece of why, you know, it's fun. It's fun when you're able to help the family move forward in a very short period of time. And that really does a lot for staff morale. So that's it for me.
This is Jen with the Alliance. I just want to thank Tess and Joe for their great presentations. We've received a lot of questions, so I'll try to go through these pretty quickly. Tess, the first question is directed to you. What support or technical assistance have you found transitional housing providers moving to rapid rehousing need to make that shift?
Yeah, great question. So, I mean, I think really Joe did an excellent job of talking about the sort of cultural shift within the agency of moving from an agency that thinks about needing to provide framework and program rules that where, you know, within a transitional housing model, there was an understanding that that framework, those program rules were what would help families be successful, and moving to programs where what we're recognizing is that in fact when families are making their own decisions, they're engaging with the case managers on an equal basis, that they are able to be actually quite a bit much more successful. So the biggest training and technical assistance I feel like we've been providing, that we have been providing to the agencies over the past couple of years, has really been around the cultural shift that needs to occur within the agency to get ready to shift from that temporary housing model to a permanent housing model. So really going through and looking at your program rules, really understanding the job descriptions of your case management staff. What we're expecting from case management staff for transitional housing is very different than what we expect for case management under rapid rehousing. And really sort of digging into your agency skills around problem solving and conflict resolution, because I think a lot of the approach that we're taking with rapid rehousing that really works is, again, that sort of neutral partner helping families to resolve the aspects of their crisis that they've got the resources and control over themselves.
Great, thank you. The next question is, what HMIS do you use and what assessment tools do you use?
So our HMIS provider is Bowman, and we're not using a Bowman assessment tool. So for good or for bad, whether we're crazy or not, I'm not sure. We developed our own coordinated assessment tool. So just a little bit of history. In 2011, when we introduced coordinated assessment in Pierce County, we had an assessment tool that was probably a 90-minute, at best, a 90-minute interview that was based on a biopsychosocial evaluation of the family or individual that was coming to coordinated assessment for assistance. And about a year and a half ago, we started the process to eliminate that very long sort of biopsychosocial assessment and moving to an assessment that is much more based on housing barriers and vulnerability. So I know a lot of these use the VI SPDAT, for example, but when we looked at the VI SPDAT, what we felt, and it's just the way we approached it, we felt that there was still a lot of information in the VI SPDAT was still asking a lot of questions that weren't really directly relevant to matching the households with the appropriate housing intervention. Decided to basically do our own tool that serves the purpose for which coordinated entry exists, which is to match households to the appropriate housing intervention. And then our providers are really the ones that do the more in-depth. Once the referral is made, the providers do a much more in-depth assessment with the family, again, as part of case management. So we've taken that biopsychosocial of it out of the role of coordinated entry and appropriately left it where we think it belongs, which is with the providers through their case management process.
Thank you. Joe, this question is for you. How do you address breaking down stereotypes for landlords who might be unwilling to rent to your clients?
Yeah, that's, again, a great question. It's something that we all struggle with probably throughout the country, because let's face it, landlords want to protect their property and they want to get paid. And they're not usually willing to take unnecessary risks. When they have a family that can qualify, they fill out an application and they qualify, then they would rather take those families than somebody that when they do the application, they come back and say, wait a minute, this person doesn't have a job, why would I take them? So we do spend a lot of time talking to landlords, and we talk to them in a business conversation versus a heart conversation. So we want to help them realize that they are going to get paid. The client's going to pay their portion, we're going to pay our portion, and that they will be paid on time. So thinking about it from that approach, it's a business conversation. So when we're out talking to landlords, that's the kind of conversation we have. We ask our families, they have to make first contact with the landlord. It's part of that empowerment piece. We'll give them all kinds of resources, but they go make contact with the landlord, talk to the landlord, and we have a letter that they take with them that outlines the program. And often, what the next step is, our case manager will end up talking to the landlord and explaining how the project works, and with the goal of having that family transition in place and being able to pay their rent on the road. Again, they're thinking about it as a business, so that's how we approach it, as what are the concerns of the landlord, and those are the concerns that we try to address. But it's not easy. Big apartment complexes have, the 20, 30-page applications, and they have a lot of legalese in there, and they might not be able to allow a family to come in because they can't treat families different based on the fair housing laws. So we often use smaller private landlords, people that maybe have a duplex or an eightplex or something like that, that have more flexibility in being able to allow different types of people coming into their housing.
Thank you. Another question for Joe. As you mentioned, even though families are able to increase their income during the program, it still it would seem to be beyond what average rents are in the area. How do they manage that gap?
Yeah, another great question. When we say that often we have families that when they transition in place, they may be bringing in somebody else to live with them, maybe another family member. Now that they've got stable and they're away from the abuser, so they're not, they don't have those kind of concerns. So roommates, family members that come in and live with them, that was the average increase in income. We have some people that, some clients that have a work history and do really, really well. But it's one of those, like Tess was saying, the resiliency of the families to figure out ways to make it is it's really amazing to see that they figure out how to do it. Maybe 80% of their income is going toward rent, and they're using food banks and other types of services to get by on the rest of the stuff. But they are in a position to be able to maintain that permanent housing. It's not always pretty, but the goal is, can they get to a point where they can pay for their own housing and utilizing other resources to make ends meet, sort of.
Thank you. Tess, I have a question for you. Could you expand upon why you're maintaining transitional housing for unifying families and young pregnant women?
Yeah, I'd be happy to. So we have a couple of programs here locally that are specifically focused. One program in particular is specifically focused on women who are recovering from substance use and whose children have been removed from their homes. So they go into the program, and it is a transitional housing program. We go into the program and they're both continuing with their recovery and working through the system to regain their custody of their children. And in looking at that program in particular, we worked a lot with that provider, and that provider is actually extremely interested in moving from transitional housing to rapid rehousing. But I think really in looking at that program in particular, we realized the complexity of issues that the families were involved in, particularly when they're trying to work through the legal regaining custody of their children. It just didn't really lend itself to a rapid rehousing model as easily. We haven't, we haven't sort of, given up all hope that maybe it could be a more shorter time frame for those families. But in that case, we just think that the unique nature of the circumstances of those families warrants a longer stay within the program. But what we've done is we've worked with that provider to really reduce program rules and to begin to sort of mimic, if you will, the aspects of a rapid rehousing program around making sure that the women are focusing not just on their recovery and their children, but also on gaining employment and or education, making sure that they're prepared for moving into a rental unit when they're on their own by, establishing, cleaning up their credit and getting experience to landlords. And so there's aspects of that program that we think, sort of walk between the worlds of transitional housing and rapid rehousing. But it's just, in those circumstances, we just think that the nature of the assistance and support that those families need in those particular instances are well suited within the program structure that's already been developed with these tweaks that I've described.
Thank you. Joe, this is a question for you. Where are the DV families coming from? Are they referrals from shelters, or are they being referred directly to rapid rehousing?
Yeah, another great question. We have, in Pierce County, we have, we're working on coordinated entry and figuring out ways that most of the other housing providers are able to have families screened and then being directed to different agencies. Because we're working with domestic violence families and the confidentiality of the information with federal rules and state rules, we are currently still taking applications directly from the public. It's on our website, and as I said before, we really reduced it down to just a couple of pages, just essential information. But that shelters, I think probably roughly about 50% of our families will come from shelters, which is ideally where we'd like to get them from. The more families we can pull from shelters, the more openings they have for those families that are really in an emergent situation of fleeing. So we like to take families from shelters. We have great relationships with all of the local DV shelters in particular, but other shelters that work with families, because there's DV families find all kinds of support out there in different agencies. And we just make sure that everybody knows that when we have openings available, and within rapid rehousing, it's nice because it's not like a fixed number. We used to have a COC, within COC where it was transitional housing, and we could only have 10 families. So we couldn't bring in 11 families. We had to wait for one of those families to exit before we could bring in another family. Now with rapid rehousing, we have the flexibility. We can have 15 at one point, then down to 12, and up to 18. So that provides a lot more flexibility for bringing families in. But mostly from shelters, referrals, they come from all over. And again, because we're the largest provider of rapid rehousing in Pierce County, we don't advertise it very much because it's mostly coming from word of mouth. People know about us, and when they have problems, they submit applications. Get a lot of phone calls too.
Thank
Hopefully that
you.
answers the question.
Yes, great. Okay, well, it looks like we have one last question for Tess. Could you tell us the role of emergency shelter in helping connect families to the right intervention, and do you prioritize emergency shelter entry?
Yeah, great question. Really good question. It's such a great question that we're still sort of struggling with it a little bit. So we see emergency shelter as the front door to permanent housing. So emergency historically in Pierce County has been used, probably not dissimilarly to how it's been used in other areas, as historically it was almost as an end in of itself. Average days in our emergency shelter was anywhere from 90 to 120 days. And it wasn't uncommon for a family to circulate through one shelter and then go into another shelter, end up spending anywhere from a half a year to a year in shelter. So the goal now with coordinated entry is that shelter is respite. So we fully embrace the goal that nobody should be in shelter for longer than 30 days. And coordinated entry, the way coordinated entry will work with shelters is where we are, in some cases, most of the cases for our family shelters, they're not same-day shelters, so you actually get a referral from coordinated entry to shelter. So the goal will be to do a co-referral into shelter and into a permanent program. So a family would be referred to shelter and immediately, within a day or two, be meeting with their case manager or the agency that will help them into rapid rehousing. We're not prioritizing access to our same shelters. So all of our single adult shelters are considered same-day shelters, and one of our family shelters is considered shelter. It is, I think it's a long-term goal to actually get to a place with our same-day shelters where we could prioritize access to beds, but it'll take us ramping up our diversion skills, those early problem-solving skills that diversion programs build within a community to really get to a place where we feel like we're comfortable doing that. So long-term, by which I mean not this year, but long-term, the goal is to get to that place, but we're not quite.
Thank you. I'm sorry, one last question that just came in. How do you evaluate case management?
Was that for Joe?
Yes, I'm sorry.
So how do I evaluate case management? Is that was
yes.
the question?
Yes, I'm sorry.
Okay.
Yes.
Okay. Well, we talk daily. Again, it's a small agency, so we probably got at any given time from 40 to 50 families or so. On a daily basis, I'm talking to the case managers, particularly about the families that we're having difficulty with, or the family, I should say. The families having difficulty in making progress toward the goals. They create their own goals, and in moving through those. So as far as evaluating the case managers, I totally trust my staff. They've been here for quite a while. I've been very fortunate with not a lot of turnover. But on a daily basis, what I look at is the conversations I'm having with the case managers. We're discussing strategies. We're just, they come in and ask me and say, hey, they need cars for their vehicle. So we have conversations about, okay, what does that mean? We buy cars, tires, and then what's going to happen? So those interactions with the case managers on a daily basis is what I use to ensure myself that they're keeping the focus on the family. And as long as they keep the focus on the family, then things work out. It's when we start focusing on what's better for the agency is where we have breakdowns in the support we're providing. So it's really all about the case managers. I mean, everything I do, the funding that we raise, the contracts that we do, everything is to support the case managers in their role of helping the family. So they are basically the most important aspect of our business is having highly qualified and highly trained case managers. And I require them every year, everybody on staff has to go to some level of training specifically for what they're doing here at the agency. And just as a matter of fact, here in a couple of months, I have 2 case managers that will be speaking at a national conference, and that's pretty impressive for an agency that only has 7 people that we've been asked to present at a national conference about how rapid rehousing can successfully serve families fleeing from domestic violence.
That's great. Well, that's all the questions we have. I just want to thank Tess and Joe for their excellent presentations and remind everybody that we'll be posting the audio and the slides tomorrow. We'll be sending out in the next day or so a rapid rehousing newsletter with more information. And also to put in a plug for our next webinar, which will be on March 8th at 1 p.m. Eastern Time, and we'll be talking about transforming the homeless system in Jacksonville, Florida. So thank you again for everyone participating.
You're welcome. Just so everybody knows, if you need any extra support or ideas, you're welcome to contact me at any time.
Thank you.
Okay, thank you all.